sorry, I'm Dr. Martin.
Can you elaborate?
Chief Medical Officer at Elbowwoods. I'm sorry, now get out of the way. And the first question we had was, in many of the COVID reports in the news, we hear false positives. In the COVID tested in the U.S., this reportedly means you were not COVID infected, but had still a positive test result. So the first question was, are there also false negatives in the COVID testing? Yes. Almost every test has false positives that says you do have it when you don't, and there are going to be tests where you say you don't have it when you do, and that's a false negative. The nice thing about most of the PCR tests that we're using is that the false positive, false negative rates are usually less than 10%. So, and some of them are even better than that. Some of them are less than 3%. So they try to account for that in the tests that the FDA has approved. So a false positive means that the test says that you do have a condition or a disease, and with coronavirus it says you do have coronavirus and you don't. And have we had any false positives in the Elbowwoods testing? Not that we are aware of. We do know that a lot of people are concerned that they may have false positives because their test comes back positive and they don't have any symptoms. But we know that there is a large group of people who are asymptomatic, who do not have any symptoms at all, but do have the virus. And what we found that with those people who are thinking they're false positive, the people around them are also positive. So it's very unlikely that we're getting a group of false positive results. So, and how do we determine if someone is false positive, false negative? What we're doing here, if we see someone who is symptomatic, who has symptoms, and their test comes back negative, we are doing we are also sending a test off to the state to verify ours. So we are doing 2 tests to be sure that we do have the correct result. And if somebody comes back and thinks their test is incorrect and says that we do tell them they're positive and they don't think they are, we are retesting them just to verify, and so far we don't have any false positives or false negatives that we are aware of.